Our Marshall Zellinger set out amid today's chaos and confusion to figure out what this is going to mean for hundreds of millions of dollars for Coloradans.
And resolve this. But I would say between 6 a.m. and 8 a.m. was a very busy time.
For a short time on Tuesday, organizations that rely on federal dollars, like Denver Health, did not know if that money would be available by the end of the day.
We get about $89 million from the federal government for a variety of programs, community clinics, research, etc.
President Trump tried to freeze federal spending today, creating confusion for much of the day. Confusion even from allies of President Trump.
So I wanted to take a minute to lay out what we know.
Republican Congressman Gabe Evans was not quite clear when trying to clear up what federal funding was at risk.
We do know that programs that directly pay individuals will not be affected by the freeze. We also don't know how this will affect student loans or Head Start programs. We're waiting for more specifics on that.
Not knowing how it impacts Head Start would be a $120 million question mark. That's how much Colorado providers receive to help educate 11,000 low-income children. Though in a new memo this afternoon, the president's budget team said funds for Head Start would not be paused. Today was a good lesson on learning who relies on federal funds. More than one-third of the budget for Colorado's Department of Public Health and Environment is paid for through federal money. The biggest chunk of that is for WIC, helping women, infant, and children purchase healthy foods and get nutrition services. That's $92 million. Immunizations for local health agencies get $53 million. Nutritious food at adult and child care centers, $29 million. And the Ryan White Act, which provides HIV and AIDS care for those with low incomes, that gets $19 million. Tonight, a judge blocked the federal funding freeze following a lawsuit by 22 states, including Colorado.
They're in red states and they're in blue states. And so depriving people of those needed health care services is going to have catastrophic impacts on the health of the population, but also, quite frankly, politics.
The way the day was explained to me is, imagine you personally had plans for tonight, or you had a vacation coming up, and the money you expected to use for that was suddenly not in your account or would not be in your account. State and local governments rely on federal money. Nonprofits rely on it. Schools, police. Each of those entities need to start reviewing how it pays for services, Kyle, just in case the money they expect never arrives.
So the Trump administration puts out this sweeping order that is clear as mud. And then when people are like, well, this would be catastrophic and this would be catastrophic, then they come out and say, well, those things aren't included, and why are you fools even worried about that? They're like mocking people for being confused about an unclear order.
The follow-up memo that said, no, we're really targeting programs that fund these things that we no longer want to fund, would have been more clarifying as the initial memo or order instead of a halt to everything so we can review that we're not paying for things that we as an administration no longer want to support.
Marshall Zellinger, thank you very much.